So I'm a physical therapist, and I currently teach in the physical therapy program in the Department of Rehab Sciences, which is in the College of Allied Health. When you come from where I've been, I have 3 degrees in physical therapy. I have a bachelor's degree, which is the degree that I went to school for. Now that entry-level degree is a doctorate of physical therapy. I have a master's that came from OU. So both my bachelor's and my master's came from OU. And then I ended up doing my PhD here in Allied Health and Leadership. So I've been here at the university for a very long time doing many different components of education and teaching within the university. So currently I am the vice chair of the department and coordinate both the physical and occupational therapy programs here at the university, and teach in both the PhD and the Doctor of Science program also. A typical day or work week, I'm going to look at it from the time when I was out practicing. Since I teach now, it's a different kind of environment. But when I was out practicing, my background is in pediatrics. And my favorite population to work with are infants and toddlers who are in what we call the early intervention program. So within that program, I'm working with infants and toddlers who have delayed development or have diagnoses like Down syndrome or cerebral palsy or spina bifida, or some genetic syndrome that we don't even know what it is yet. And within those days, I would go out and work with the children and their families or their caretakers at their homes or wherever the family wanted me to be. So there were times in my career when I was doing early intervention that I would drive 2 hours south of town and work my way back into town, seeing 6 or 7 different families as I came back into town for scheduling. So I would go to their homes, I'd meet them at parks, I would take them swimming in their swimming pools in their community, just anything like that to help them be able to engage in their community, help the kids learn to move and participate in their daily activities, and help the families figure out how to help their kids be successful. So that was a day in my life when I was working as an early intervention therapist. For other therapists, they work in outpatient environments. So I've worked in pediatric outpatient, which is similar to adult outpatient. But in that environment, I'm seeing kids there, but on a more frequent basis. The kids are coming in and I'm working with them and their families there at that outpatient facility. So in those days, I would maybe see 10 or 12 kids a day. But when I was out traveling on a regular basis, it wasn't as many because there were those drive times in between. And then if, a combine got in front of us and that would slow us down, etc. Or if there were cows in the road, we'd have to get them off the road and go from there. But that wasn't every day, but it made it adventuresome. When we think about interdisciplinary care, it is very much part of physical therapy. So out in the community, when you're working in the community, you're working with physicians and nurses and occupational therapists and speech pathologists, depending on the environment you work in. If you're working in a hospital, you'll work with all of those individuals. If you're working in an inpatient rehab, you'll work with all of those individuals plus more. If you're in the pediatric world that I was talking about, which is early intervention, I was out individually seeing kids and their families, but there was team members that were part of the team that I worked on where if I needed an OT or if I needed a speech pathologist or I had a medical question, there were team members I could go to and have them come work with me with the family. Here at the university, in the program that I teach in, we have both occupational and physical therapy in the same department. So what's really nice is we're able to educate those students together for some of their classes and then separately for other parts of their class. So they start to learn what it's like to work as an interdisciplinary team and learn as an interdisciplinary team. And then when we coordinate their clinicals and their fieldwork experiences out in the community, we're setting them up to work in environments where they're working with all the different team members. And then back in the university, we have 4 different departments in the college and several different degrees within those departments. And so we do interprofessional activities there as well as across the whole university when we bring the students together from all the colleges for All Professions Day and begin to learn together what each other can do, how they support a team, and how you can rely on each other to implement practice for the ultimate goal of having the best care possible for the clients we're serving. I really considered being a physician, and I thought I wanted to be a neurosurgeon, but I have a hand tremor, and neurosurgery and hand tremors are not going to go together. Between that and the length of education at that point in time, I was like, I don't want to be in school that long. So that's why I really looked at other healthcare professions. And for me, physical therapy and how people move and how they get from one place to another, and also being a profession where I could work with little kids, infants and toddlers, all the way up to older individuals, gave me that spectrum of individuals I could work with and know that I was providing care and helping them in the best possible way for their needs. So that's how I ended up in physical therapy. Now, when someone comes to me and they're exploring physical therapy, I encourage them to look at all the areas of practice. It is one of the healthcare fields that allows you to interact with clients on a long-term basis versus like a quick in and out of the office appointment. So that's one of the nice things about physical therapy. When you think about what to look for or look at, I want them to think about all the environments we can work in. So we can work in hospitals, home health, outpatient facilities, skilled nursing facilities, inpatient rehab. There's so many locations we can work. We can specialize down and work with clients with different conditions. What's really nice about our profession also is maybe in your time of life, once you have your degree, you need to work fewer hours. And it's also a profession that sometimes part-time works really well, and then someone comes back to full-time. Or they've been working in the geriatric environment and they want to work in a different environment. So there's a lot of education that you can take to keep up your skills and move from one environment to the other. So when someone's looking at physical therapy, I want them to think about all the different options and all the different clients they may be able to work with and the environments they can work in. And I think that's what's so nice about physical therapy, is you can go so many different directions. Being on the Health Science Center campus is an amazing place to be. You have individuals who, once you've made the decision to be in degrees that are here, our goal is to help you succeed in those degrees. It's not to weed you in or out. It's like once you've gotten into a program, let's say physical or occupational therapy or speech pathology, yes, you have to make the grades, you have to gain the skills, you've got to put the effort in, but we're there to help you gain those skills and succeed. And I think that's what's amazing about our campus is we're setting up and building those individuals who will have the skills, the knowledge, the compassion, and the empathy to keep providing care and service for our community and our state and hopefully others around the country. And I always think about it that I'm training people, I'm educating individuals who will eventually have a license and someday they'll be taking care of me. So I want them to have the skills and the ability to treat my family members and me someday, because as healthcare goes, there's a very big chance I'll need a physical therapist when I get older, or not even when I'm older, when it's now and I've sprained my ankle or I have plantar fasciitis or something like that. So I want them to be able to get to the point that they can be a care provider that I would want to send a family member or myself to go to.